Hello, my name is Tim White, and I am running as a Democrat for the 2nd U.S. Congressional seat in Oregon in 2018. Let's talk about health care today. Sometimes it is difficult to say what you want to say instead of what you think people want you to say. This is one of those times. Yes, I think Medicare should be expanded to age 55 versus the current 65. For all others, I think we should have a single-payer universal health care system. Medicare expansion would be a near-term goal, and universal single-payer, unfortunately, will have to be a longer-term goal. So the question is, what do we do in the meantime? To start with, we fix the ACA. We all know the Affordable Care Act had some major flaws. It was such a monumental change to accessibility and affordability of health care in the U.S., there were bound to be issues. Congress has simply chosen not to do their job, but rather the bidding of the health insurance and pharmaceutical companies. Democrats believed if we could just get health care reform in the door, Congress would be forced to address the shortcomings and make it better. Well, that did not happen. And do you know why? Money. Pure and simple. Insurance companies feel their gravy train is being threatened. Pharmaceutical companies know their drugs are overpriced, and eventually the government will be forced to come after them and regulate prices like all other developed countries presently do. Why do you think the architect of the repeal effort, Greg Walden, is largely funded by the pharmaceutical and healthcare industry? Well, one of the ACA requirements that seems to really set off the other side is the requirement to buy insurance or pay a penalty, also known as the mandate. Nobody, including me, likes the idea of being told they have to buy something. In the case of health insurance, however, there is a very logical and supportable reason for this requirement. Virtually all people will at some time in their life become ill or have an accident. When this happens, hospitals by law must treat the uninsured when they show up in the emergency room. The cost is then borne by all of us who do carry and pay for the insurance. So yes, they should participate and pay into the system. Will younger people use it less? Of course. But when they are older, they will use it more. That is how an insurance risk pool is supposed to work. The problem with politics is that it is a process that requires a candidate to frame a message in the most simplistic manner in the hopes that it will resonate with the voters, cause them to vote for that person, kind of like Make America Great Again. It sounds wonderful. It does absolutely nothing. Unfortunately, the Democratic message of single payer or Medicare for all has some of that same flavor. It sounds great, but it oversimplifies an incredibly complex issue and provides no roadmap for how to make that actually happen. Healthcare is complicated, it is political, and there is an incredible amount of profit involved. The current system is not simply going quietly into the night. To campaign otherwise would be disingenuous on my part. Consider, there are nearly 6,000 full care hospitals in the U.S. Over 1 million doctors. There are some 70 major health insurers with revenues of $700 billion. There are 165 major pharmaceuticals with revenues of $450 billion. These businesses are not going to give in to single payer without a fight. Think about this example for just a second. The gun industry is a $14 billion a year industry that has been able to stop universal background checks that 90% of the population wants and supports. In comparison, health insurance and pharmaceuticals have a combined revenue of nearly $1.2 trillion. They have funded Walden and his propaganda for nearly 20 years. The Obama team realized this was a quagmire and cut some deals to start the process. Not all of them were great deals, but most likely they were required to get any kind of agreement from the health insurance and pharmaceutical companies. This included government premium subsidies for health insurance and an agreement Medicare would not negotiate the price of drugs. And how has that worked out for these folks? They are making record-breaking profits and simultaneously claiming Obamacare is killing them. Consider United Healthcare, the nation's largest health insurer that is leaving the marketplace exchanges. They claimed Obamacare losses of $850 million in 2015. Yet, 2015 profit was a record, and then they exceeded it in 2016. Their CEO took home $20 million in 2015, which was a pay cut from his $66 million he made in 2014. Over at Aetna, their CEO took home $28 million in 2015 based on their record performance. While some Democrats campaign on Medicare for All, Walden and the GOP have recently announced plans to look at cuts to Medicare in 2018. While other Democrats campaign for single payer, Walden and the GOP continue to spoon feed their base on the horrors of Obamacare, which they eat up like turkey at Thanksgiving. The reality is all Americans, Democrat and Republican, are being shortchanged by the insurance and healthcare industry, while politicians keep us at each other's throats to deflect the issue and do nothing to improve the care. So here are a few ideas to consider to rein in healthcare costs and eventually get us to a universal single-payer system. Number one, declare medical insurability and treatment a basic human right in the United States. 2, all drug prices and changes to drug prices to be approved by the FDA based on a set determined return on development cost. 3, all medical treatment costs to be approved based on regional cost of doing business and approved by the FDA. 4, no allowable differentiation of drug or medical costs based on insurance. 5, prohibition of all prescription drug advertising on television and social media. Unless you have a degree from medical school, you do not know what Humira will or will not do for you. 6, all health insurance premiums to be approved by either the insurance commissioners or the FDA, taking into consideration regional economics and set determined return on invested asset and cost of business. 7, finally, implementation of universal single-payer insurance by the year 2027. My 7-point plan will ensure quality health care for all Americans. Thank you.